Okay, so I'm going to show you how to do the crusting technique, which is a technique that we do for skin around a stoma when it's irritated, open, moist, eroded, or denuded. This can happen when you have a lot of leaking problems for whatever reason. So the most important thing is to try to dry out the skin and put a protective layer. And that's what crusting does. So in order to do crusting, you need some stoma powder and some skin protectant. So all of this is available in distribution. You might even have it on your cart. So the first thing you want to do is pull off the pouch and then clean the skin. Just water, that's all we recommend. Do not use anything fancy. Do not use the barrier wipes that you have at the bedside, the cleaning wipes, just water. We like to use these disposable washcloths. We get a few wet and some dry. So we clean the skin as best as possible and we let it dry. If you're also preparing the pouch, you can do that first. So you have it ready to go and then you do your skin care. So everything's clean, the pouch is prepped. Then I take the stoma powder and you're going to sprinkle it on. You can be very liberal with it. It doesn't hurt the stoma, doesn't matter if you hit it or not. And so then I'll grab a dry wipe and you dust off all the excess. It's only going to stick to the moist skin. So the eroded skin, you'll see it'll be white. The rest of the intact skin, you'll be able to dust it off, but dust off all the excess. Okay. And then you'll seal it with the Cavalon. You can use the Cavalon spray as well, but you don't need a lot. Then you put a thin layer over everything. You might have to dab if you need it. And then, so that gives a good layer of crust. Dries it out and protects it. If you need to do another layer, if the erosion is really severe, you can do 1, 2, or 3 layers. Usually 1 is enough. So that dries. Once it dries, then you can go ahead with your barrier ring and then your skin barrier. So we use crusting if the skin is eroded and moist, open. If it's just irritated, if the skin is just pink or red, but it's intact, you do not have to use the stoma powder. You can use just the skin protectant, and that's fine. Just a thin layer is fine. If you put too much on there, it can almost interfere with the pouching system. Just a thin layer. If the skin around the stoma is perfectly healthy, looks like the rest of your skin, you don't need to use any of this. You don't even need to use the Cavalon. Some people that have had an ostomy for a long time, they do it as a matter of course. If that's their practice, that's fine, as long as they're getting a good seal. And that is skincare before you put a pouch on with special focus on crusting. Thank you.